We have a very interesting EEG today, and I would want you to try to interpret this EEG and provide a report to the referring physician. What I want you to do is, as we move along, so let's do that right away. So as we move along, I want you to compare the left hemisphere with the right hemisphere. So compare the channels on the left and the right and see if there is any asymmetry in terms of amplitude, in terms of frequencies, in terms of asymmetries in slowing. If you see any sharp waves, then you report those sharp waves. And at the end of these 3 or 4 slides, I want you to write down a report as the kind of report you would write down to report an EEG and see if you are able to get to the diagnosis of this patient. So on this particular EEG, compare the left hemisphere with the right hemisphere. Do you see any change in amplitude? Do you see any asymmetry in amplitude between the left parasagittal and the right parasagittal contacts? Do you see any asymmetry in the frequencies? Are the same kind of frequencies seen in both hemispheres? Let's move on to the next slide. Over here, can you determine the state of the patient? Is the patient asleep or is the patient awake? Let's see if you're able to identify that. And if you see any sleep potentials, is there any difference between the left and the right hemisphere? Moving on to the next slide, again carefully compare the left hemisphere with the right hemisphere. Look at the frequencies. Do you have the same amount of beta activity between the left and the right hemisphere? See if you're able to. So take a pen and a paper, try to scribble down your answers to all these questions that I'm asking you. Now go back to this slide and see if you're able to identify any asymmetry between the left and the right hemisphere. So let's move back to the slide number 1. What I want you to do is, so you carefully read the history of any patient that you are about to interpret the EEG. So you need to be careful about the clinical history. You get a good clinical history from the information that is provided to you. Then you go in the description section. Do you see a posterior dominant alpha rhythm? In this case, we see an asymmetry between the left hemisphere and the right hemisphere. You see a posterior dominant alpha rhythm on the right hemisphere, specifically looking at the contacts P4O2. And when you compare it with P3O1, you see that there is an asymmetry. You are seeing more slow activity in the left hemisphere. There is a better mixture of frequencies in the right hemisphere. Moving on to the next slide here, this is a state of sleep. Patient is asleep. If you look carefully at the K complexes here, you will notice that the slowing is asymmetric. The K complexes are asymmetric between the left and the right hemisphere. They are better formed on the right hemisphere. Moving on to the next slide here, look at the beta activity. Look at the parasagittal contacts. So parasagittal contacts are F4, C4, C4, P4, P4O2. Those are parasagittal contacts on the right side. Compare that with the left side. Do you see an asymmetry? Again, you see a very rich mixture of frequencies on the right hemisphere, and you do not see the same on the left hemisphere. Moving on to the next slide, you can see that the amplitudes appear much lower on the left hemisphere and not as much. When you compare it, the left hemisphere to the right hemisphere, you can identify that the amplitudes are significantly lower on the left hemisphere. So based on everything, so you should also report the ECG, the heart rate, which in this case varies from 53 to 54 beats per minute. So putting this all together, number one, we do not see any epileptiform discharges. We do not see any electrographic seizures. We see an asymmetry in amplitude with lower amplitudes on the left hemisphere. We see an asymmetry in frequencies with a posterior dominant alpha rhythm seen on the right hemisphere but not on the left hemisphere. We see more slowing on the left hemisphere than the right hemisphere. Putting all these together, you can suspect that most likely there is a structural abnormality in the left hemisphere of the brain. And if you got that answer correctly, congratulations, you are progressing very well in your interpretation of the EEG. If you were not able to get the answer, if you were not able to identify the asymmetry between the two hemispheres, I would suggest go back to slide number 1 and look over it carefully a few times at least so that you can develop your comfort level. Now, this patient had a very large stroke in the left hemisphere, as you can see on the CT scan, and this is what is causing all the asymmetries that we have noticed between the left and the right hemisphere. I will appreciate if you can write your comments about these tutorials so that I know whether this is something that is helping you or whether I should change my format and provide you with information that will be more useful in your clinical practices. Thank you so much.